I am Dr. John Pierre Lindenmayer, clinical professor in the Department of Psychiatry at the New York University School of Medicine. Overestimating medication adherence diminishes the ability of psychiatric care providers to determine the most effective treatment for their patients and to identify some of the causes of treatment resistance in patients with schizophrenia. Consider the case of a patient with schizophrenia whose disease is out of control due to the lack of adherence to their atypical antipsychotic. Psychiatrists who incorrectly assume that the patient is adherent to their medication may subsequently decide to increase the patient's psychotic dose, switch the patient to another antipsychotic, or augment with additional medications in an effort to improve treatment response. These efforts, however, may be ineffective as they ignore the underlying cause of the symptom exacerbation, namely the patient non-adherence to their antipsychotic. New technologies may offer physicians additional insight into whether or not patients are adherent. MEMS-caps, video-observed therapy, and digital medicines with ingestible sensors all offer the potential for providers to observe credible patient drug adherence information more rapidly. It is not clear, however, whether more accurate information on patient medication adherence would change psychiatrists' prescribing behavior when treating patients with schizophrenia. To answer this question, I would like to give you a brief overview of our study, Access to Credible Information on Schizophrenia Patients' Medication Adherence by Prescribers Can Change Their Treatment Strategies, Evidence for Online Survey of Providers. For this study, we conducted an online survey of 219 healthcare practitioners who routinely prescribe antipsychotics to patients with schizophrenia. The survey contained 8 clinical case vignettes describing different patients with schizophrenia and their current antipsychotic medication regimen. A clinical case vignette is a brief, carefully written description of a person or situation that is designed to simulate key features of real-world patient and clinical scenarios. The 219 respondents were randomly assigned to either an experimental or a control group. Although both groups received the same basic case vignettes, the vignettes for the experimental group included an additional sentence describing credible patient drug adherence information, whereas the control group did not receive this information. Following each clinical case vignette, respondents were instructed to choose a preferred treatment recommendation from a set of pharmacologic and non-pharmacologic options. The primary outcome of interest was prescribers' treatment choice for each case. Using this approach, we found that among patient vignettes where the patient was non-adherent, the share of providers recommending long-acting injectable treatment was 25.8% for respondents in the control arm without credible patient drug adherence information, but was 77.7% among respondents in the experimental arm with access to credible patient drug adherence information. In contrast, for the vignettes depicting adherent patients experiencing significant psychoses, we found that respondents with access to credible patient drug adherence information were more likely to increase the antipsychotic dose compared to respondents without access to credible patient drug adherence information. The paper contains more details on how exactly these prescribing patterns differed across the two groups. Generally, our results suggest that absence of credible measures of adherence may be contributing to suboptimal treatment choices. Having access to credible adherence information has the potential to improve outcomes and reduce healthcare costs associated with schizophrenia, and will also help clinicians to evaluate potential side effects more accurately if they know whether the relationship with medication is plausible or not.